Hello, my name is Kirk Fallon, and I'm an admissions officer with UT Health San Antonio's School of Health Professions. This video contains a brief overview of just a few of the degree programs our school offers. Please join me and the rest of our admissions team at our information session to learn more about our programs and how you can begin your journey into healthcare at UT Health San Antonio's School of Health Professions. Our first program is Speech-Language Pathology. Speech-language pathologists, or SLPs, are licensed professionals who work to assess, diagnose, treat, and help prevent speech, voice, language, cognitive linguistic, and swallowing disorders across the age span. As part of their work, SLPs address a wide range of skills. They might help a child with social skills issues make appropriate conversation, for instance, or they might help struggling readers learn phonological awareness and gain comprehension. SLPs often work as part of a collaborative interdisciplinary team, which may include teachers, physicians, audiologists, psychologists, and a number of other professionals with a holistic goal in mind for the patient. Our next program is Respiratory Care. Respiratory Care deals with assessing and treating patients with acute and chronic dysfunctions of their cardiopulmonary system. A respiratory therapist cares for patients with pneumonia, emphysema, and lung trauma. Respiratory therapists also provide emergency care such as artificial respiration, external cardiac massages, and resuscitation. Some of the equipment RTs work with are ventilators, aerosol generators, and gas administration gear. You may be more familiar with respiratory therapy in the context of COVID-19, as many respiratory therapists cared for affected patients. Occupational Therapy. Occupational therapy is the treatment of people who are unable to perform some everyday functions due to injury, illness, or disability. Occupational therapists utilize activities with specific goals to enhance the quality of life and increase the independence of individuals who have a mentally, emotionally, or physically disabling condition. OTs sometimes help individuals modify their homes or find tools to use to help them live a better life. Specific functions of an occupational therapist include creating, planning, and conducting rehabilitative programs to help people restore their daily living skills. They also train the caregivers of their patients on how to provide for their needs in therapy. Lastly, we have medical laboratory scientists, often known as medical technologists, who work with other members of the healthcare system to perform and supervise laboratory analyses on blood, body fluids, and tissues. They conduct these analyses and convert it into data to detect, diagnose, and monitor diseases. Medical laboratory scientists use equipment such as microscopes, computers, and other instruments that can help them convert lab work into data. Their main tasks are to conduct chemical analyses of fluids to determine the presence of normal or abnormal things. They check these analyses to find the number of cells, the morphology or shape of cells, as well as finding out if fluids such as urine or spinal fluid are made up of the expected components. Many medical laboratory scientists work in hospitals, diagnostic labs, or physicians' clinics. Now that you know a little bit about the programs we offer, I invite you to join us at our information session to ask questions and learn about our admissions process. Thank you for watching, and I'll see you there.